very hard to follow that, but it again instills in me that we are all here trying to do the right thing, and we can't do it alone. You know, a vital community is important, but a quality community where we are working together is much more important. I'm going to talk to you a little bit about some of the initiatives we've been involved with. The state of Indiana, for several years, has been working on perinatal infant mortality and levels of care and trying to improve the health and well-being for women and infants. And without their visionary leadership to pull all of the volunteers that represented many of the 92 delivering hospitals in the state of Indiana, we wouldn't really be where we are today. So what I'm going to take you through is some of the initiatives that we have been working on besides regionalizing perinatal levels of care so that moms that are high risk are delivering at the appropriate level of hospitals. And these are some of the initiatives that we have been actually working on. So if we look specifically at the Southwest region, what have we been working on? You've heard a lot in regards to obesity and overall health and well-being of women. What we have to understand, too, is that the average age of a first-time mom is later in her 20s. Physically, that makes a little bit more of a toll on our body as a woman. So we have probably waited until college for these planned pregnancies, let's just say. Obesity is a factor, fertility is a factor, as well as overall impact on health if we're trying to have a baby. Tri-State Perinatology has worked on a very comprehensive diabetic program for not only adult onset women that are pregnant with diabetes, but in addition, gestational diabetics. They have to be monitored very closely and need a lot of resources and support as they're going through their pregnancy so they stay on course. Preconception care is huge. We are just dabbling now in some of the efforts related to preconception care, just as we've seen in some of the statistics where we might be behind the 8 ball if we are thinking that we're going to convince kids when they're in high school to avoid smoking and avoid drugs. It's the same thing with pregnancy. Hitting them with information or giving them information when they are already pregnant, we've already missed a mark in their life, and we've got to get to them before. So we have a lot of work to do with that. But in addition, what we've done is transformed some of the ways we communicate with the women in our community, a lot more mobile and a lot more of social media because they don't just like to read things on pieces of paper. So we have an app. It's called the Oh Baby app. It started out with dealing with pregnancy and helping them to learn and understand what is going on within their pregnancy. And we are adding other components such as that first year of life with that baby and developmental milestones and when they should be intervening or getting additional resources. But our next step is to look at then the whole preconception part and what can we do to continue to address some of the health needs by providing educational offerings for couples that are contemplating pregnancy. One of the things we did in looking at access and early prenatal care was to become more mobile. And to actually go to the moms in Echo Clinic as well as some of the family practice, the Deaconess Family Practice Residency Program, with getting them to enroll in a lot of our programs. They're assigned a maternal care advisor who will remind them about classes and prepare them for the baby and during their pregnancy, provide them with touches. We feel that if we continue to hit them periodically or address periodically how are they doing with their smoking, how are they doing health-wise, we will get a lot more compliance and more or less act as a resource for them. We've changed our Baby Palooza Fair to almost an event every 2 months because it was a much smaller and intimate setting where moms and their significant others could come and hear about other classes and what they need to be doing to maintain that healthy pregnancy. Social service staff has worked with Little Lambs because what we found out were moms that then were admitted for a high-risk pregnancy and maybe on the antepartum unit for a while, they might not have access to earn those vouchers, which are so important for them for diapers and for safe sleep, like pack and plays. So we worked with Little Lambs to say, okay, what could we do? What could we help to we'll continue to educate them. Can they still earn some of these vouchers once they're discharged? One of the things also with early and adequate prenatal care, as you know, is preterm labor. State of Indiana has been working very hard on a medication called 17P, and this is an injection that a provider needs to prescribe for a mom if she has had a preterm birth before, or if she has had a spontaneous rupture of membranes in previous pregnancy. One of the caveats that we're finding as we work on these initiatives is, yes, there's a pre-authorization required, but if we go too early to get that pre-authorization, because she must start those injections between 16 and 24 weeks of pregnancy and take them up until 37 weeks of her pregnancy. But if we try to get them, if we find out at 12 weeks that she meets the criteria for this, they will tell us that we're going too early, that our pre-authorization isn't going to go through right now, and we need to wait. And that is very frustrating. But at least as we work on these, with the infrastructure that the state has already set in place, we can be that voice to help to get the insurance companies to change this so that it makes it easier and accessible for those patients that require it. In regards to increasing breastfeeding and the duration and exclusivity of breastfeeding, we are a baby-friendly designated hospital. We jointly did that with St. Vincent's a couple years ago to make sure that as a community we were being supportive and making sure that we were sending the right message on the importance of breastfeeding. We have 24-hour in-house lactation specialists, as well as a Great Beginnings outpatient services. And these are services that are not exclusive just if you delivered at our hospital. It's for the community. Anybody can call if they've had a baby, and if it's 2 o'clock in the morning and it's a winter night and nobody's going to want to come in to see a lactation specialist, they can do a secure video visit with that lactation specialist so that they can see and try to help them get through the night until they can receive additional care. We co-located WIC services at the hospital so that they can have easier access to some of those patients that would benefit from their services as well. We exclusively use human milk for neonates that are 32 weeks or less, and in addition, we use Prolacta as a human milk fortifier. We feel this is very important in regards to preterm babies and reducing the incident of necrotizing enterocolitis and hopefully having them be a lot healthier. We are also a milk depot for the Southwest region in the state of Indiana for donor breast milk. Some of the initiatives regarding safe sleep, because if you look at our statistics on infant mortality, this is a huge area that we do need to address. You would think it would be very easy. You educate a family on the ABCs of safe sleep. Why would they not comply with that? But until you walk in their shoes and literally know what their life is like, just as Katie alluded to within her presentation, we don't know. We have to look at it through a different set of eyes. So each family who delivers at the Women's Hospital is provided with a safe sleep sack on discharge, figuring that will go a lot further than a cupcake for them after they have had a baby or any other type of amenity. So we want to focus our amenities also on how can we continue to foster a lot of these good practices. We have educated our staff and our physician offices in regards to the ABCs of safe sleep so it can continue to be reinforced to them, as well as invited first responders within the region to attend a training session so that as they have any interactions within the home, they can also, if they see things, they can reinforce the ABCs of safe sleep and make sure that there's a crib and that the baby does not have a lot of blankets and toys in the crib with them as well. We provide cribs for kids. We're a part of Cribs for Kids with the state as well, where we will provide a pack and play for those families who do not have the means to have a crib or for the baby to sleep in. We are provide the safe car seat program for the fittings for the car seats, as well as for those families that have a need. In regards to smoking, we participate with the Vanderburgh County's Baby and Me Tobacco-Free program. And in regards to perinatal substance abuse, this has probably been our largest project that we have worked on. And each time we work on it, there's like another arm. It's almost like an octopus that comes out of it that we need to address. But we've tried to pull together various community agencies and stakeholders so that we can start to fill the gaps and identify some additional barriers for these moms. And we had the pleasure of hearing from Jessica how important that a program like that is. We've worked with an OB-GYN locally to make sure that he had the support he needed to complete the MAT training for prescribing moms that are addicted the right medication through the rest of their pregnancy, and co-manage that with a maternal fetal medicine specialist so that they're getting, in a sense, the best of both worlds. We have educated hospital personnel on an appropriate and uniform approach for identifying NAS babies. These babies can sometimes go undetected because if they get discharged from a hospital in 2 days, their symptoms might not show up for several days. And so we've missed that opportunity. And so a lot of these are pilot projects that we're involved with, and we will continue to change them and evolve them as the data comes out from the different avenues. We developed a toolkit, and we're working on developing a toolkit for the screening. Right now, the state is looking at data coming out from the pilot hospitals, whether or not meconium or cord blood is the better route for identifying exposure to substance abuse. And that will also impact our treatment plans. We are standardizing what we call non-pharmacologic as well as pharmacologic measures for both the mom and the baby, so that the mom can know what can she do for her baby as her baby is going through this withdrawal process, because it is not anything that anybody wants to watch. And unfortunately, we have now predisposed that baby to a potential life of addiction as well. We are following up with those babies in our NICU follow-up clinic. And we will continue to add the additional family and social resources and services that are needed to provide them with the best opportunity they can hand. But I think the thing that has been the biggest success is the Stepping Forward relationship that we have and the partnership we have. Because as Katie alluded to, we might know the medical part of it, we don't know the rehab and the drug addiction part of it. And those are some of the programs that we have to continue to collaborate with. And as she talks about ACE and how it impacts, there's also research now coming out from the March of Dimes that looks at the genetic markers. We all know that there's a certain percent, whether it's 20% of pregnancies where you have preterm labor, that we don't know the cause. Could it be this? Could it be the fact that that mom had a genetic marker then because she had been exposed, or it had transferred from her parents that she was exposed to an incident through childhood and caused preterm labor? But as we continue to work together to look at this data and change the data accordingly for disparities and for situations, wouldn't it be great if you had an electronic health record that could also have on there so you could almost predict the likelihood that this mom might have preterm labor because of some things in her history? So that is what we have to continue to strive for and work together for.